I'm Nicole and this is Megan. We're the pharmacy team here to present to you on patient BY. BY is a 36-year-old female. She was brought into the ICU on suspected overdose of antifreeze. She was found outside West Shore Plaza and brought in by EMS. When EMS arrived, they found her unresponsive and in sinus tachycardia. She does have a past medical history for depression and suicidal ideation, and she has a family history of depression, and her mother committed suicide when she was 63. She's a single mom with a limited support system, and she reports occasional alcohol use, and she smokes a pack per day. She has no known drug allergies, and she's currently taking phenelzine and Depakote at home. In the ambulance, she did receive 4 milligrams of naloxone with no relief of her symptoms. In the emergency department, she was given etomidate, succinylcholine, sodium bicarb, and normal saline. Now here in the ICU, she's been receiving fentanyl 25 micrograms per hour continuous infusion, nicardipine 5 milligrams per hour continuous infusion, propofol 50 micrograms per kilogram per minute continuous infusion, sodium bicarb, normal saline, pantoprazole, and heparin. Her vital signs, her blood pressure is 191 over 115. The most recent retake was 195 over 120. Her heart rate is 124 beats per minute. She is intubated and her temperature is 38.8 degrees Celsius. Some pertinent lab values, her ethylene glycol level is 33 milligrams per deciliter. Her serum creatinine is 2.5 milligrams per deciliter from a baseline of 0.8. Her calcium is 5.7 milligrams per deciliter. Her white blood cell count is 27,000 cells per microliter. And her blood gas pH is 7.12. Her sodium bicarb level is 4.2 milliequivalents per liter. And her urine analysis did indicate calcium oxalate monohydrate crystals. And her chest x-ray indicated left lower infiltrates, and a culture of her nares indicated MRSA. Her blood and urine cultures are still pending.
So for the patient's assessment, the patient has a suspected stage 2 overdose of antifreeze as evidenced by her ethylene glycol level, an elevated anion gap of 36.8 milliequivalents per liter, metabolic acidosis, an osmolar gap of 24 milliosmoles per kilogram, hypocalcemia indicated by a corrected calcium of 5.86 milligrams per deciliter in urinary crystals. There is also suspected pneumonia as evidenced by the chest x-ray results and the positive nares for MRSA. So the plan for the antifreeze overdose, we want to immediately initiate the patient on fomepizole 1,875 milligrams loading dose IV, followed by 1,250 milligrams every 12 hours for a total of 4 doses. Then we're going to have the patient on 1,875 milligrams every 12 hours. Since the patient does have severe metabolic acidosis, we're going to continue IV sodium bicarb of 150 milliequivalents. Goals of therapy, we want to reduce the ethylene glycol level to less than 20 milligrams per deciliter, and we want to eventually remove it all. We're going to stabilize the patient's vitals, normalize pH, and electrolytes. We're going to prevent any permanent damage and address any psychological issues that may have contributed. For monitoring, we're going to look at the patient's vital signs, mental status, urine output, respiratory status, urinalysis, electrolytes, ABG, CBC, serum lactate level, and osmolarity, as well as the BNP. Once the patient is stable, we're going to consult for social work, and we're also going to request a psychiatric eval. For the blood pressure management for this patient, we're going to continue IV nicardipine, but we're going to titrate it up by 2 milligrams per hour every 5 to 15 minutes for a maximum dose of 15 milligrams per hour due to the elevated blood pressure. Then we're going to assess the need for chronic therapy once the patient is stable. So the goals of therapy for the patient's blood pressure is we want to get it down to less than 160 over 100 within the first 6 hours, and then we're going to want to decrease organ damage. We're going to continuously monitor the patient's blood pressure. For the patient's pneumonia, we're going to initiate the patient on levofloxacin IV 750 milligrams every 24 hours for a total of 5 days. We're going to counsel the patient on smoking cessation and provide her with resources for quitting. The goals of therapy, we want to clear the infection, prevent complications, reoccurrences, and any adverse drug effects. And we're also going to monitor the patient's white blood cell count and signs and symptoms, altered mental status, and signs and symptoms of tendinitis. And that concludes our patient presentation.